Hi, I am Heather Calvin, and this is my mother, Lynda Miller, and she's one of the most important and special people in my life. Things got really, really scary at the beginning of 2021 when my mom got COVID. She was admitted to the hospital early morning, or I guess mid-morning on January 1st. She was in there for 9 days. And it's the first time that she's had a serious health care concern where I wasn't able to be there by her side, advocating for her in person. And so I spent numerous hours calling in, talking to anyone I could, trying to get answers, trying to give them her important health information.
But in the hospital, the Scripps personnel, the doctors, the nurses, the aides, the technicians, the therapists, everybody was just so wonderful and so caring and so attentive.
The hospitalist said, I think we're gonna be able to release her tomorrow. And I said to the doctor on the phone, I'm like, what would you do if it was your mom? And he goes, honestly, Heather, I would have had my mom out of here yesterday, because this place right now in the middle of this pandemic is no place for your mom to be. She needs to get out as soon as she's able. Don't worry, we will set you up with home support. You won't be alone. She'll be taken care of. You'll be taken care of.
Hi, I am Dr. Alexie Nguyen. Home-based care is a physician-led multidisciplinary team that composes of physicians, nurse practitioners, complex case managers, and social worker that actually visit and care for the patient in their home.
But then as soon as she was able to be released, they released her, and we had, even before she was released from the hospital, someone from the hospital showed up at my front door with an oxygen tank, delivering oxygen for her because she would need that at home. We had people within the first 16, 18 hours come to visit.
Hello, my name is Dr. Anil Keswani. Dr. Nguyen and I sat down and talked about how can we build a program together that provides the care the patient needs without having them needing to leave the house. Our home-based care program is truly built around the patient. Our physicians go to the house. Our care teams manage them remotely. And we make sure that patients get everything they need without having to come back into a hospital, a clinic, or a skilled nursing facility.
I think the willingness of so many people to come into my home and care for me, risking their own health, their time, and doing so in such a loving, caring, kind way. I'll never get over it, really.
We saw that there was a huge demand for home-based care services. I think many of our patients who were already limited by their ability to access care is even more challenged now.
Home was where we need to take our providers and our care teams out to make sure that they can help the patient recover at home.
I'm so hopeful and so excited at the possibility that people in the future, whether it's because of COVID-19 or any other disease, if there's someone in my shoes having to take care of a family member, I'm hopeful that they get the support and care that I had taking care of my mom, because I don't think I could have lasted all of those weeks and months without that support.
The challenge we have for ourselves is to bring our clinicians and our staff together and say, what are we going to do over the next 18 months? How are we going to continue to provide the care that patients want when and where they need it?
Between God looking out for me and Scripps and the care that they gave, and Heather and my family and the love and care that they provided, I know that's why I'm here.
I love you so much.